you're able to join us.
Yes.
So, first things first, welcome to our day of conversation. Would you mind giving a quick intro of yourself?
Thank you. No, I'm uh, Dawn Lee Akers. I am the medical outreach director for Diabulimia Helpline, also known as DBH. We support, educate, advocate for people with diabetes and eating disorders.
Wow, that's amazing. So, first up, for anyone watching who doesn't know, what is diabulimia?
So that's a really good question. Diabulimia is not a medical term. Uh, it is the comorbidity of diabetes and eating disorders. It's also known as T1DE, TIDE. It's also known as ED-DMT1, or can be ED-DMT2, eating disorders, diabetes mellitus type 1, type 2, type 3C. It is most commonly associated with insulin omission or insulin restriction. But there's probably 18% of people who have an eating disorder with diabetes and no restriction of insulin at any point. So whether it's strictly confined to that or not is up to the physicians.
Okay. So, what are some warning signs here?
So if you are using insulin manipulation or medication manipulation, so it could be GLP-1s or metformin, the signs and symptoms will be anything associated with high blood sugar. So thirst, peeing a lot, slow wound healing. You get abscesses in just lots of different places, particularly private places. Long-term complications tend to run retinopathy, kidney disease, cardiac disease, that kind of thing. And then if you have an eating disorder without medication manipulation, it's going to be the same signs and symptoms as any eating disorder. Yeah, which you've already talked about earlier today.
But Dawn, that's amazing that you have developed support specifically for individuals with diabetes and eating disorders. You know, it's very hard, I think, when you get an eating disorder diagnosis. I mean, when you get a diabetes diagnosis, right? Because now they're controlling you, they're telling you what to eat, and that's not, no one's interested in that. And so you kind of do get set up like you have to go on dieting just like anybody else that could get an eating disorder. What I've seen is a lot of people, children will start hoarding food because they're not allowed to have it, right? So they are afraid that you're going to take away their sugary food, so they like get a stash of it. So that's one thing that I've seen, and I have so much compassion for someone with diabetes trying to figure out how to take care of themselves and all the conflicts they must have.
Yeah, so there is a lot of I guess I would call it social pressure, a focus on numbers, the education that you have. One of our favorite quotes is from Dr. Ann Goebel-Fabry from the Joslin Diabetes Institute, where she says, teaching a person how to manage diabetes is akin to teaching them how to have an eating disorder.
Right?
And you almost can't have diabetes without having some level of disordered eating and a focus on numbers and things like that. It also really messes up your metabolism, regardless of what type you have. People are 2.5 times more likely to have an eating disorder if they have diabetes than without. And so there's the education piece, the social pressure piece, the focus on numbers piece, but then there's also just your body is messed up and the insulin isn't working right and the leptin isn't working right and the ghrelin isn't working right. nothing is working right in your body, and that in and of itself can pull the trigger on an eating disorder.
Dawn, I just give you so much credit for having an organization specifically for people with diabetes and eating disorders, because you almost don't, there's not much you hear about it or see about it, but yet it's got to be so common.
Oh, it is very common. 1 in 3 women and 1 in 7 men will omit or restrict their medication in order to lose weight or maintain weight.
Wow.
And that doesn't count the people who have an eating disorder. One of our board members had anorexia and never omitted her insulin. So that doesn't even count them. So
Right,
it's
right.
very, very common and very little talked about.
Right. And high stakes,
Yeah.
right? I mean, you can easily die, right? If you
Oh,
don't
very
have the
high
right,
stakes.
yeah.
Every time a person goes into diabetic ketoacidosis, it could be their last time. I remember I have 3 children with type 1 diabetes. One of them,
Wow.
Erin, had a severe eating disorder. She went into diabetic ketoacidosis a number of times, landed in the ICU at the hospital. And I remember one of the times the doctor came out and said to us, "We've been treating this for 24 hours and we should see an improvement in her blood work by now. We're not seeing an improvement. You need to start thinking about what you want to do long term." And I almost lost it, because by that point we had been in and out so many times, it had become almost routine. And to understand that, no, this really could be the last time. She is fine. She is
She
totally
is.
recovered.
Oh my gosh.
It was
Thank
not
you
the
for
last
telling us.
time.
Oh,
But
Oh,
it's very serious. And the other thing is that complications that you get what during your eating disorder, so kidney disease, gastroparesis, retinopathy, that's permanent. Even after you recover from the eating disorder, that doesn't go away. You have killed those nerves, and they may regenerate somewhat, but they're never going to regenerate back to what it was originally. So my
mhm.
daughter struggled for a decade, for 10 years before she recovered. And at first they didn't even recognize it. They just said she was a rebellious teenager. And so she will take medication for the rest of her life because of the complications.
Did she inspire you to be part of the organization that you have now?
She did. She actually started the organization. So
oh
Amazing.
Erin was originally scheduled to be on this call, and as luck would have it, she is actually dealing with a client emergency. I am our medical outreach director. I sit on our board of directors, and so I agreed to go on in her place at the last minute. Very last
Well,
minute.
well, thank
that's
you so much, and
important.
respect to those
Yes,
priorities. Like absolutely. So
definitely,
I know
definitely.
we had a lot of back and forth getting you on, but could you, before our time ends, could you tell us a little bit more about the diabulimia helpline and maybe mention your upcoming conference?
Yes. Um, so we have a 24/7 helpline that people can call. It's 425-985-3635. You can also find it on our website, which is dbh.org. Um, and we have a database. We offer online support groups. We have a database of treatment referrals, people who have experience with both diabetes and eating disorders. That's a hard squirrel to find. And then every other year since 2018, we've been doing a conference, an annual conference. It's international. This year it is in New York City. It's May 2nd to the 4th. You can find registration, more information, an agenda, who our speakers are. It's
Mhm.
all on our website. It's a 2-track event. So there is one track for healthcare professionals with CE credits who want to learn more about how to treat this, because you really have to treat it as intertwined, not treat the eating disorder and the diabetes separately. That doesn't work. There are many studies that show that doesn't work. Even if you have the same psychopathology as a person that has the same eating disorder but without diabetes, it doesn't work. And then there's a second track for people with diabetes who are experiencing an eating disorder, disordered eating, issues with food, anything like that.
That's amazing. And all of this information is going to be in the resource roundup. So if you're watching and haven't registered, go ahead and register to make sure you get all of the follow-up information after that.
There you go.
Dawn, it's amazing hearing what you guys are doing, and please give Erin our best, because
I will do that.
You and she are doing something so needed and so important. You really made me think, like, this is just something we never talk about, we never hear about. So ANAD, Kristen and Jason and everyone, thank you for putting Dawn and Erin on the schedule, because it's super important.
Yes, very important.
All right, Maria, thank you for hopping in. Always good to see you. Dawn, thanks for
Anytime.